BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 3. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. A typical pneumonia is most commonly caused by Option A. Streptococcus pneumoniae. Option B. Mycoplasma pneumoniae. Option C. Staphylococcus aureus. Option D. Klebsiella pneumoniae. The correct answer is option B. Mycoplasma pneumoniae. Let's go through the options. Streptococcus pneumoniae. Streptococcus pneumoniae causes typical lobar pneumonia. Staphylococcus aureus. Staphylococcus causes post-viral or hospital pneumonia. Klebsiella pneumoniae. Klebsiella causes a severe pneumonia in alcoholics. And the correct answer is Mycoplasma pneumoniae. Mycoplasma pneumoniae is the commonest cause of atypical pneumonia. So, the right answer is option B. Mycoplasma pneumoniae. Question 2. Pienka is most characteristically associated with Option A. Wegener granulomatosis. Option B. Microscopic polyangiitis. Option C. Polyarteritis nodosa. Option D. Takaisu arteritis. The correct answer is option B. Microscopic polyangiitis. Let's go through the options. Wegener granulomatosis. Wegener granulomatosis is linked with Pienka. Polyarteritis nodosa. Polyarteritis nodosa is usually ANCA negative. Takaisu arteritis. Takaisu arteritis is not ANCA associated. And the correct answer is microscopic polyangiitis. Microscopic polyangiitis is associated with Pienka. So, the right answer is option B. Microscopic polyangiitis. Question 3. The treatment of choice for Helicobacter pylori infection is Option A. Triple therapy. Option B. Single agent metronidazole. Option C. Ranitidine alone. Option D. Sucralfate. The correct answer is option A. Triple therapy. Let's go through the options. Single agent metronidazole. Single agent metronidazole breeds resistance. Ranitidine alone. Ranitidine alone does not eradicate it. Sucralfate. Sucralfate only coats the ulcer. And the correct answer is triple therapy. Triple therapy, a proton pump inhibitor with 2 antibiotics, is the treatment of choice. So, the right answer is option A. Triple therapy. Question 4. Duodenal ulcer pain is characteristically Option A. Worse immediately after meals. Option B. Worse at night and relieved by food. Option C. Unrelated to meals. Option D. Worse on lying flat only. The correct answer is option B. Worse at night and relieved by food. Let's go through the options. Worse immediately after meals. Pain right after meals suggests a gastric ulcer. Unrelated to meals. Pain unrelated to meals is not typical. Worse on lying flat only. Pain worse lying flat suggests reflux. And the correct answer is worse at night and relieved by food. Duodenal ulcer pain is worse at night and relieved by food. So, the right answer is option B. Worse at night and relieved by food. Question 5. In a diabetic patient with crescent formation on renal biopsy, The diagnosis is Option A. Diabetic nephropathy. Option B. Amyloidosis. Option C. Minimal change disease. Option D. Rapidly progressive glomerulonephritis. The correct answer is option D. Rapidly progressive glomerulonephritis. Let's go through the options. Diabetic nephropathy. Diabetic nephropathy gives nodular sclerosis, not crescents. Amyloidosis. Amyloidosis does not form crescents. Minimal change disease. Minimal change shows a normal biopsy. And the correct answer is rapidly progressive glomerulonephritis. Crescents indicate rapidly progressive glomerulonephritis. So, the right answer is option D. Rapidly progressive glomerulonephritis. Question 6. Hypertensive encephalopathy characteristically presents with Option A. Hematuria and edema. Option B. Chest pain and sweating. Option C. Seizures, headache and blurred vision. Option D. Jaundice and pruritus. The correct answer is option C. Seizures, headache and blurred vision. Let's go through the options. Hematuria and edema. Hematuria and edema are nephritic. Chest pain and sweating. Chest pain and sweating are cardiac. Jaundice and pruritus. Jaundice and pruritus are hepatic. And the correct answer is seizures, headache and blurred vision. Seizures, headache and blurred vision are the features of hypertensive encephalopathy. So, the right answer is option C. Seizures, headache and blurred vision. Question 7. Total villus atrophy of the small bowel mucosa may result from Option A. Hookworm. Option B. Ascaris infestation. Option C. Amoebiasis. Option D. Giardia lamblia infection. The correct answer is option D. Giardia lamblia infection. Let's go through the options. Hookworm. Hookworm causes iron deficiency anemia. Ascaris infestation. Ascaris causes obstruction. Amoebiasis. Amoebiasis causes colitis. And the correct answer is Giardia lamblia infection. Giardia lamblia causes villus atrophy and malabsorption. So, the right answer is option D. Giardia lamblia infection. Question 8. A bruit heard over the costovertebral angle in a young hypertensive female suggests Option A. Fibromuscular dysplasia. Option B. Atherosclerotic renal artery stenosis. Option C. Pheochromocytoma. Option D. Coarctation. The correct answer is option A. Fibromuscular dysplasia. Let's go through the options. Atherosclerotic renal artery stenosis. Atherosclerotic stenosis affects older patients. Pheochromocytoma. Pheochromocytoma gives episodic symptoms. Coarctation. Coarctation gives an arm-leg pressure difference. And the correct answer is fibromuscular dysplasia. Fibromuscular dysplasia causes renovascular hypertension in young women. So, the right answer is option A. Fibromuscular dysplasia. Question 9. Hyperparathyroidism in a child characteristically produces Option A. Hypocalcemia. Option B. Hyperkalemia. Option C. Hypercalcemia. Option D. Hyponatremia. The correct answer is option C. Hypercalcemia. Let's go through the options. Hypocalcemia. Hypocalcemia is the opposite. Hyperkalemia. Hyperkalemia is unrelated. Hyponatremia. Hyponatremia is unrelated. And the correct answer is hypercalcemia. Parathyroid excess raises the serum calcium. So, the right answer is option C. Hypercalcemia. Question 10. Burkitt lymphoma is highly sensitive to option A. Radiotherapy. Option B. Chemotherapy. Option C. Surgery. Option D. Immunotherapy. The correct answer is option B. Chemotherapy. Let's go through the options. Radiotherapy. Radiotherapy is not the mainstay. Surgery. Surgery is not curative. Immunotherapy. Immunotherapy is not the main treatment. And the correct answer is chemotherapy. Burkitt lymphoma is highly chemosensitive. So, the right answer is option B. Chemotherapy. Question 11. A jaw mass in a 7-year-old African child is most likely option A. Osteosarcoma. Option B. Ameloblastoma. Option C. Burkitt lymphoma. Option D. Ewing sarcoma. The correct answer is option C. Burkitt lymphoma. Let's go through the options. Osteosarcoma. Osteosarcoma affects the long bones. Ameloblastoma. Ameloblastoma is a slow jaw tumor. Ewing sarcoma. Ewing sarcoma affects long bones. And the correct answer is Burkitt lymphoma. A jaw mass in an African child is classically Burkitt lymphoma. So, the right answer is option C. Burkitt lymphoma. Question 12. The string sign on barium study is characteristic of option A. Intussusception. Option B. Achalasia. Option C. Pyloric stenosis. Option D. Volvulus. The correct answer is option C. Pyloric stenosis. Let's go through the options. Intussusception. Intussusception gives a target sign. Achalasia. Achalasia gives a bird beak. Volvulus. Volvulus gives a whirl sign. And the correct answer is pyloric stenosis. The elongated narrow channel, the string sign, indicates pyloric stenosis. So, the right answer is option C. Pyloric stenosis. Question 13. A bird beak appearance on barium swallow indicates option A. Achalasia. Option B. Esophageal carcinoma. Option C. Pharyngeal pouch. Option D. Hiatus hernia. The correct answer is option A. Achalasia. Let's go through the options. Esophageal carcinoma. Carcinoma gives an irregular stricture. Pharyngeal pouch. A pharyngeal pouch is a posterior outpouching. Hiatus hernia. A hiatus hernia shows stomach above the diaphragm. And the correct answer is achalasia. A smooth bird beak tapering is achalasia. So, the right answer is option A. Achalasia. Question 14. A donut sign on abdominal ultrasound suggests option A. Pyloric stenosis. Option B. Intussusception. Option C. Appendicitis. Option D. Volvulus. The correct answer is option B. Intussusception. Let's go through the options. Pyloric stenosis. Pyloric stenosis gives a string sign. Appendicitis. Appendicitis shows a non-compressible tube. Volvulus. Volvulus gives a whirl sign. And the correct answer is intussusception. The donut or target sign indicates intussusception. So, the right answer is option B. Intussusception. Question 15. A steeple sign on neck X-ray indicates. Option A, foreign body. Option B, acute epiglottitis. Option C, retropharyngeal abscess. Option D, croup. The correct answer is option D, croup. Let's go through the options. Foreign body. A foreign body is seen directly. Acute epiglottitis. Epiglottitis gives a thumb sign. Retropharyngeal abscess. A retropharyngeal abscess widens the prevertebral space. And the correct answer is croup. The steeple sign of subglottic narrowing indicates croup. So, the right answer is option D. Croup. Question 16. A thumb sign on lateral neck X-ray indicates. Option A, croup. Option B, tracheitis. Option C, laryngomalacia. Option D, acute epiglottitis. The correct answer is option D, acute epiglottitis. Let's go through the options. Croup. Croup gives a steeple sign. Tracheitis. Tracheitis is different. Laryngomalacia. Laryngomalacia gives an omega epiglottis. And the correct answer is acute epiglottitis. The thumb sign of a swollen epiglottis indicates acute epiglottitis. So, the right answer is option D. Acute epiglottitis. Question 17. A pear-shaped cardiac shadow on chest X-ray suggests. Option A, mitral stenosis. Option B, tetralogy of Fallot. Option C, pericardial effusion. Option D. The correct answer is option C, pericardial effusion. Let's go through the options. Mitral stenosis. Mitral stenosis straightens the left border. Tetralogy of Fallot. Fallot gives a boot-shaped heart. Aortic aneurysm. An aneurysm gives a mediastinal bulge. And the correct answer is pericardial effusion. A pear or flask-shaped shadow indicates a pericardial effusion. So, the right answer is option C. Pericardial effusion. Question 18. Hyperthyroidism treated with radioactive iodine that later becomes hypothyroid indicates the original disease was. Option A, toxic multinodular goiter. Option B, Graves' disease. Option C, toxic adenoma. Option D, thyroiditis. The correct answer is option B, Graves' disease. Let's go through the options. Toxic multinodular goiter. Toxic multinodular goiter is less typical. Toxic adenoma. A toxic adenoma is a single nodule. Thyroiditis. Thyroiditis is transient. And the correct answer is Graves' disease. Graves' disease commonly becomes hypothyroid after radioiodine. So, the right answer is option B. Graves' disease. Question 19. Ascaris lumbricoides may cause all of the following except. Option A, aplastic anemia. Option B, asthma-like symptoms. Option C, biliary colic. Option D, intestinal obstruction. The correct answer is option A, aplastic anemia. Let's go through the options. Asthma-like symptoms. Larval migration causes asthma-like symptoms. Biliary colic. A worm can block the bile duct, causing colic. Intestinal obstruction. A worm bolus can cause intestinal obstruction. And the correct answer is aplastic anemia. Ascaris does not cause aplastic anemia, so this is the exception. So, the right answer is option A. Aplastic anemia. Question 20. Portal hypertension is defined as a portal venous pressure of option A 3 to 5 millimeters of mercury. Option B 8 to 10 millimeters of mercury. Option C 20 to 50 millimeters of mercury. Option D 60 to 80 millimeters of mercury. The correct answer is option C 20 to 50 millimeters of mercury. Let's go through the options. 3 to 5 millimeters of mercury. 3 to 5 is the normal portal pressure. 8 to 10 millimeters of mercury. 8 to 10 is only mildly raised. 60 to 80 millimeters of mercury. 60 to 80 is far too high. And the correct answer is 20 to 50 millimeters of mercury. Portal hypertension is a pressure of about 20 to 50 millimeters of mercury. So, the right answer is option C. 20 to 50 millimeters of mercury. Question 21. Peptic ulcer disease presenting with shock is managed by option A. Laparotomy. Option B. Endoscopic clipping only. Option C. Conservative treatment. Option D. PPI infusion alone. The correct answer is option A. Laparotomy. Let's go through the options. Endoscopic clipping only. Endoscopic clipping alone is inadequate for perforation. Conservative treatment. Conservative treatment risks death. PPI infusion alone. A proton pump inhibitor infusion alone does not treat perforation. And the correct answer is laparotomy. A perforated ulcer with shock needs laparotomy. So, the right answer is option A. Laparotomy. Question 22. A decubitus ulcer is best described as A. Option A. Venous ulcer. Option B. Arterial ulcer. Option C. Neuropathic ulcer. Option D. Pressure sore. The correct answer is option D. Pressure sore. Let's go through the options. Venous ulcer. A venous ulcer is around the ankle. Arterial ulcer. An arterial ulcer is on the toes. Neuropathic ulcer. A neuropathic ulcer is on pressure points in diabetics. And the correct answer is pressure sore. A decubitus ulcer is a pressure sore from prolonged lying. So, the right answer is option D. Pressure sore. Question 23. An antibioma is option A. A mass of fibrous tissue around a small abscess treated persistently with antibiotics. Option B. A drug reaction. Option C. An antibiotic-resistant organism. Option D. A form of cellulitis. The correct answer is option A. A mass of fibrous tissue around a small abscess treated persistently with antibiotics. Let's go through the options. A drug reaction. It is not a drug reaction. An antibiotic-resistant organism. It is not a resistant organism. A form of cellulitis. It is not cellulitis. And the correct answer is a mass of fibrous tissue around a small abscess treated persistently with antibiotics. An antibioma is a fibrous mass around a partly treated abscess. So, the right answer is option A. A mass of fibrous tissue around a small abscess treated persistently with antibiotics. Question 24. Burn wound debridement is commonly performed under option A. Spinal anesthesia. Option B. Halothane. Option C. Ketamine. Option D. Local infiltration. The correct answer is option C. Ketamine. Let's go through the options. Spinal anesthesia. Spinal anesthesia is not suitable for burns. Halothane. Halothane is not preferred here. Local infiltration. Local infiltration is inadequate for large burns. And the correct answer is ketamine. Ketamine gives analgesia and is favored for burns dressing. So, the right answer is option C. Ketamine. Question 25. In Berger disease, the patient is at risk of option A. Renal failure. Option B. Cerebral infarction. Option C. Gangrene of the digits. Option D. Pulmonary embolism. The correct answer is option C. Gangrene of the digits. Let's go through the options. Renal failure. Renal failure is not typical. Cerebral infarction. Cerebral infarction is not typical. Pulmonary embolism. Pulmonary embolism is not typical. And the correct answer is gangrene of the digits. Berger disease causes digital gangrene in young smokers. So, the right answer is option C. Gangrene of the digits. Question 26. Lumbar sympathectomy is of value in the management of option A. Distal ischemia affecting the skin of the toes. Option B. Deep vein thrombosis. Option C. Varicose veins. Option D. Lymphedema. The correct answer is option A. Distal ischemia affecting the skin of the toes. Let's go through the options. Deep vein thrombosis. Deep vein thrombosis needs anticoagulation. Varicose veins. Varicose veins are treated by ablation. Lymphedema. Lymphedema is not helped. And the correct answer is distal ischemia affecting the skin of the toes. It helps distal skin ischemia of the toes by causing vasodilation. So, the right answer is option A. Distal ischemia affecting the skin of the toes. Question 27. The nerve of Kuntz is an important landmark in option A. Radical neck dissection. Option B. Thyroidectomy. Option C. Carotid endarterectomy. Option D. Cervicodorsal sympathectomy. The correct answer is option D. Cervicodorsal sympathectomy. Let's go through the options. Radical neck dissection. Radical neck dissection does not involve it. Thyroidectomy. Thyroidectomy does not. Carotid endarterectomy. Carotid endarterectomy does not. And the correct answer is cervicodorsal sympathectomy. The nerve of Kuntz is a landmark in cervicodorsal sympathectomy. So, the right answer is option D. Cervicodorsal sympathectomy. Question 28. A branchial cyst characteristically presents as option A. A midline neck swelling. Option B. A swelling at the anterior border of sternomastoid. Option C. A posterior triangle mass. Option D. A submental swelling. The correct answer is option B. A swelling at the anterior border of sternomastoid. Let's go through the options. A midline neck swelling. A midline swelling suggests a thyroglossal cyst. A posterior triangle mass. A posterior triangle mass is different. A submental swelling. A submental swelling is different. And the correct answer is a swelling at the anterior border of sternomastoid. A branchial cyst lies at the anterior border of sternomastoid. So, the right answer is option B. A swelling at the anterior border of sternomastoid. Question 29. Ewing sarcoma on X-ray characteristically shows. Option A. Onion peel appearance. Option B. Soap bubble appearance. Option C. Sunburst appearance. Option D. Ground glass appearance. The correct answer is option A. Onion peel appearance. Soap bubble appearance. A soap bubble is a giant cell tumor. Sunburst appearance. A sunburst is osteosarcoma. Ground glass appearance. Ground glass is fibrous dysplasia. And the correct answer is onion peel appearance. The onion peel periosteal reaction is Ewing sarcoma. So, the right answer is option A. Onion peel appearance. Question 30. Carcinoma of the breast is characteristically described as having. Option A. Smooth and sharp margins. Option B. A fluid-filled center. Option C. A well-defined capsule. Option D. Irregular and ill-defined margins. The correct answer is option D. Irregular and ill-defined margins. Let's go through the options. Smooth and sharp margins. Smooth sharp margins suggest a benign lump. A fluid-filled center. A fluid-filled center suggests a cyst. A well-defined capsule. A capsule suggests a fibroadenoma. And the correct answer is irregular and ill-defined margins. Breast cancer has irregular, ill-defined margins. So, the right answer is option D. Irregular and ill-defined margins. Question 31. The commonest malignancy of the small intestine is. Option A. Lymphoma. Option B. Adenocarcinoma. Option C. Carcinoid. Option D. Sarcoma. The correct answer is option B. Adenocarcinoma. Let's go through the options. Lymphoma. Lymphoma is less common. Carcinoid. Carcinoid is less common. Sarcoma. Sarcoma is rare. And the correct answer is adenocarcinoma. Adenocarcinoma is the commonest small bowel malignancy. So, the right answer is option B. Adenocarcinoma. Question 32. Verrucous carcinoma is a squamous cell carcinoma. Option A. Alcoholics. Option B. Smokers only. Option C. Tobacco chewers. Option D. Diabetics. The correct answer is option C. Tobacco chewers. Let's go through the options. Alcoholics. Alcoholics develop other cancers. Smokers only. Smokers get other oral cancers. Diabetics. Diabetics are not specifically at risk. And the correct answer is tobacco chewers. Verrucous carcinoma occurs in tobacco chewers. So, the right answer is option C. Tobacco chewers. Question 33. Bishop scoring does not include Option A. Cervical dilatation. Option B. Cervical effacement. Option C. Fetal presenting part. Option D. Station of the head. The correct answer is option C. Fetal presenting part. Let's go through the options. Cervical dilatation. Cervical dilatation is included. Cervical effacement. Effacement is included. Station of the head. Station of the head is included. And the correct answer is fetal presenting part. The fetal presenting part is not part of the Bishop score. So, the right answer is option C. Fetal presenting part. Question 34. The first stage of labor ends with Option A. Rupture of membranes. Option B. Delivery of the fetus. Option C. Delivery of the placenta. Option D. Full dilatation of the cervix. The correct answer is option D. Full dilatation of the cervix. Let's go through the options. Rupture of membranes. Membrane rupture can occur any time. Delivery of the fetus. Delivery of the fetus ends the second stage. Delivery of the placenta. Placental delivery ends the third stage. And the correct answer is full dilatation of the cervix. The first stage ends with full cervical dilatation. So, the right answer is option D. Full dilatation of the cervix. Question 35. The second stage of labor is characterized by Option A. Cervical effacement. Option B. Delivery of the placenta. Option C. Expulsion of the fetus. Option D. Onset of contractions. The correct answer is option C. Expulsion of the fetus. Let's go through the options. Cervical effacement. Effacement is first stage. Delivery of the placenta. Placental delivery is third stage. Onset of contractions. Onset of contractions begins labor. And the correct answer is expulsion of the fetus. The second stage is expulsion of the fetus. So, the right answer is option C. Expulsion of the fetus. Question 36. Placenta accreta is defined as abnormal adherence to the Option A. Myometrium. Option B. Superficial uterine wall. Option C. Uterine serosa. Option D. Bladder wall. The correct answer is option B. Superficial uterine wall. Let's go through the options. Myometrium. Adherence into the myometrium describes increta. Uterine serosa. Reaching the serosa is percreta. Bladder wall. The bladder wall is percreta. And the correct answer is superficial uterine wall. Placenta accreta adheres to the superficial uterine wall with absent decidua. So, the right answer is option B. Superficial uterine wall. Question 37. Placenta increta is defined as invasion into the Option A. Myometrium. Option B. Decidua basalis. Option C. Uterine serosa. Option D. Rectum. The correct answer is option A. Myometrium. Let's go through the options. Decidua basalis. The decidua basalis is the normal plane. Uterine serosa. Through the serosa is percreta. Rectum. Into the rectum is percreta. And the correct answer is myometrium. Placenta increta invades into the myometrium. So, the right answer is option A. Myometrium. Question 38. Placenta percreta is defined as invasion through the serosa into the option A. Decidua. Option B. Myometrium. Option C. Cervix. Option D. Bladder wall or rectum. The correct answer is option D. Bladder wall or rectum. Let's go through the options. Decidua. The decidua is the normal plane. Myometrium. The myometrium alone is increta. Cervix. The cervix is not the definition. And the correct answer is bladder wall or rectum. Percreta penetrates the serosa into the bladder or rectum. So, the right answer is option D. Bladder wall or rectum. Question 39. A perineal tear involving skin and muscle but sparing the anal sphincter is option A. Grade I. Option B. Grade 3. Option C. Grade 2. Option D. Grade 4. The correct answer is option C. Grade 2. Let's go through the options. Grade I. Grade 1 involves skin only. Grade 3. Grade 3 involves the anal sphincter. Grade 4. Grade 4 involves the rectal mucosa. And the correct answer is grade 2. A tear of skin and muscle sparing the sphincter is grade 2. So, the right answer is option C. Grade 2. Question 40. In luteal phase defect, besides infertility, the patient may develop option A. Postpartum hemorrhage. Option B. Early abortion. Option C. Preterm labor. Option D. Placenta previa. The correct answer is option B. Early abortion. Let's go through the options. Postpartum hemorrhage. Postpartum hemorrhage is unrelated. Preterm labor. Preterm labor is not the classic result. Placenta previa. Placenta previa is unrelated. And the correct answer is early abortion. A luteal phase defect causes early abortion from low progesterone. So, the right answer is option B. Early abortion. Question 41. The commonest organism causing urinary tract infection in pregnancy is option A. Escherichia coli. Option B. Proteus mirabilis. Option C. Klebsiella. Option D. Pseudomonas. The correct answer is option A. Escherichia coli. Let's go through the options. Proteus mirabilis. Proteus is less common. Klebsiella. Klebsiella is less common. Pseudomonas. Pseudomonas is uncommon. And the correct answer is Escherichia coli. Escherichia coli is the commonest cause of urinary infection in pregnancy. So, the right answer is option A. Escherichia coli. Question 42. Combined oral contraceptive pills are protective against option A. Breast cancer. Option B. Ovarian cancer. Option C. Cervical cancer. Option D. Hepatic adenoma. The correct answer is option B. Ovarian cancer. Let's go through the options. Breast cancer. It slightly raises breast cancer risk. Cervical cancer. It does not protect against cervical cancer. Hepatic adenoma. It can cause hepatic adenoma. And the correct answer is ovarian cancer. The combined pill protects against ovarian and endometrial cancer. So, the right answer is option B. Ovarian cancer. Question 43. Which is not a risk factor for carcinoma of the cervix? Option A. Cervicitis. Option B. Early first coitus. Option C. Multiple sexual partners. Option D. Smoking. The correct answer is option A. Cervicitis. Let's go through the options. Early first coitus. Early first coitus is a risk factor. Multiple sexual partners. Multiple partners is a risk factor. Smoking. Smoking is a risk factor. And the correct answer is cervicitis. Cervicitis is not a recognized risk factor, so it is the exception. So, the right answer is option A. Cervicitis. Question 44. In hydatidiform mole, bilateral ovarian cysts are formed from option A. Germ cells. Option B. Granulosa cells. Option C. Theca lutein cells. Option D. Stromal cells. The correct answer is option C. Theca lutein cells. Let's go through the options. Germ cells. Germ cells form teratomas. Granulosa cells. Granulosa cells form other tumors. Stromal cells. Stromal cells are not the source. And the correct answer is Theca lutein cells. High HCG stimulates Theca lutein cysts. So, the right answer is option C. Theca lutein cells. Question 45. The daily caloric requirement of a severely malnourished child is option A. 50 kilocalories per kg. Option B. 80 kilocalories per kg. Option C. 150 kilocalories per kg. Option D. 250 kilocalories per kg. The correct answer is option C. 150 kilocalories per kg. Let's go through the options. 50 kilocalories per kg. 50 is only a maintenance figure. 80 kilocalories per kg. 80 is too low for catch-up growth. 250 kilocalories per kg. 250 is excessive. And the correct answer is 150 kilocalories per kg. A malnourished child needs about 150 kilocalories per kilogram. So, the right answer is option C. 150 kilocalories per kg. Question 46. Oral polio vaccine is contraindicated in option A. Diarrhea. Option B. Malnutrition. Option C. Mild fever. Option D. Immunosuppression. The correct answer is option D. Immunosuppression. Let's go through the options. Diarrhea. Diarrhea is not a contraindication. Malnutrition. Malnutrition is not. Mild fever. Mild fever is not. And the correct answer is immunosuppression. A live vaccine is contraindicated in immunosuppression. So, the right answer is option D. Immunosuppression. Question 47. A recognized complication of oral polio vaccine is option A. Arthritis. Option B. Encephalitis. Option C. Aseptic meningitis. Option D. Severe watery diarrhea. The correct answer is option D. Severe watery diarrhea. Let's go through the options. Arthritis. Arthritis is not the recognized complication. Encephalitis. Encephalitis is not. Aseptic meningitis. Aseptic meningitis is not the listed answer. And the correct answer is severe watery diarrhea. Severe watery diarrhea is marked as the complication by the key. So, the right answer is option D. Severe watery diarrhea. Question 48. Excessive vitamin A in childhood causes. Option A. Cardiotoxicity. Option B. Nephrotoxicity. Option C. Hepatotoxicity. Option D. Ototoxicity. The correct answer is option C. Hepatotoxicity. Let's go through the options. Cardiotoxicity. Cardiotoxicity is not typical. Nephrotoxicity. Nephrotoxicity is not typical. Ototoxicity. Ototoxicity is not typical. And the correct answer is hepatotoxicity. Vitamin A excess is hepatotoxic and raises intracranial pressure. So, the right answer is option C. Hepatotoxicity. Question 49. Temper tantrums in childhood characteristically. Option A. Decrease with age. Option B. Increase with age. Option C. Remain unchanged. Option D. Begin in adolescence. The correct answer is option A. Decrease with age. Let's go through the options. Increase with age. They do not increase with age. Remain unchanged. They do not stay unchanged. Begin in adolescence. They occur in toddlers, not adolescents. And the correct answer is decrease with age. Temper tantrums decrease with age as the child matures. So, the right answer is option A. Decrease with age. Question 50. A child is considered able to take decisions at the age of. Option A. 5 years. Option B. 7 years. Option C. 10 years. Option D. 12 years. The correct answer is option B. 7 years. Let's go through the options. 5 years. 5 years is too young. 10 years. 10 is later than this. 12 years. 12 is later. And the correct answer is 7 years. A child is considered able to take simple decisions at about 7 years. So, the right answer is option B. 7 years. Question 51. Ophthalmia neonatorum is most commonly caused by. Option A. Pseudomonas. Option B. Staphylococcus aureus. Option C. Adenovirus. Option D. Neisseria gonorrhoeae. The correct answer is option D. Neisseria gonorrhoeae. Let's go through the options. Pseudomonas. Pseudomonas is uncommon. Staphylococcus aureus. Staphylococcus is a milder cause. Adenovirus. Adenovirus is a viral cause. And the correct answer is Neisseria gonorrhoeae. Neisseria gonorrhoeae causes a severe purulent ophthalmia neonatorum. So, the right answer is option D. Neisseria gonorrhoeae. Question 52. In children the eustachian tube is. Option A. Longer and narrower. Option B. Shorter, wider and more horizontal. Option C. Shorter and more vertical. Option D. The same as in adults. The correct answer is option B, shorter, wider and more horizontal. Let's go through the options. Longer and narrower. It is not longer and narrower in children. Shorter and more vertical. It is not more vertical. The same as in adults. It differs from the adult. And the correct answer is shorter, wider and more horizontal. In children it is shorter, wider and more horizontal, so infection spreads easily. So, the right answer is option B. Shorter, wider and more horizontal. Question 53. A severely dehydrated child is best treated with option A, oral rehydration only. Option B, dextrose 5%. Option C, intravenous ringer lactate. Option D, plain water. The correct answer is option C, intravenous ringer lactate. Let's go through the options. Oral rehydration only. Oral rehydration alone is inadequate in severe dehydration. Dextrose 5%. Dextrose does not restore volume. Plain water. Plain water worsens the electrolytes. And the correct answer is intravenous ringer lactate. Intravenous ringer lactate rapidly restores volume. So, the right answer is option C. Intravenous ringer lactate. Question 54. Weber test in sensorineural deafness lateralizes to the option A, affected ear. Option B, normal ear. Option C, both ears equally. Option D, neither ear. The correct answer is option B, normal ear. Let's go through the options. Affected ear. In sensorineural loss it does not go to the affected ear. Both ears equally. Equal lateralization is normal hearing. Neither ear. It does lateralize. And the correct answer is normal ear. Weber lateralizes to the normal ear in sensorineural deafness. So, the right answer is option B. Normal ear. Question 55. Rinner test compares option A, high and low frequencies. Option B, two ears with each other. Option C, air conduction with bone conduction. Option D, speech and pure tone. The correct answer is option C, air conduction with bone conduction. Let's go through the options. High and low frequencies. It does not compare frequencies. Two ears with each other. It does not compare the two ears. Speech and pure tone. It does not compare speech and tone. And the correct answer is air conduction with bone conduction. Rinner compares air conduction with bone conduction. So, the right answer is option C. Air conduction with bone conduction. Question 56. The tympanic membrane is derived from option A, ectoderm only. Option B, ectoderm and mesoderm. Option C, endoderm only. Option D, all three germ layers. The correct answer is option D. All three germ layers. Let's go through the options. Ectoderm only. It is not ectoderm only. Ectoderm and mesoderm. Not ectoderm and mesoderm only. Endoderm only. Not endoderm only. And the correct answer is all three germ layers. The tympanic membrane is formed from all three germ layers. So, the right answer is option D. All three germ layers. Question 57. Which structure has no lymphatic drainage? Option A. External ear. Option B. Inner ear. Option C. Middle ear. Option D. Nasopharynx. The correct answer is option B. Inner ear. Let's go through the options. External ear. The external ear has lymphatics. Middle ear. The middle ear has lymphatics. Nasopharynx. The nasopharynx is rich in lymphatics. And the correct answer is inner ear. The inner ear has no lymphatic drainage. So, the right answer is option B. Inner ear. Question 58. During caloric testing, warm water in one ear induces nystagmus towards the option A. Both directions. Option B. Opposite ear. Option C. Same ear. Option D. No nystagmus. The correct answer is option C. Same ear. Let's go through the options. Both directions. Not both directions. Opposite ear. Warm water does not beat to the opposite ear. No nystagmus. Nystagmus is produced. And the correct answer is same ear. Warm water induces nystagmus towards the same ear, cold to the opposite. So, the right answer is option C. Same ear. Question 59. Caloric testing is contraindicated in option A. Otosclerosis. Option B. Tympanic membrane perforation. Option C. Presbycusis. Option D. Wax impaction. The correct answer is option B. Tympanic membrane perforation. Let's go through the options. Otosclerosis. Otosclerosis is not a contraindication. Presbycusis. Presbycusis is not. Wax impaction. Wax is removed first, not a contraindication. And the correct answer is tympanic membrane perforation. A perforated tympanic membrane contraindicates water caloric testing. So, the right answer is option B. Tympanic membrane perforation. Question 60. A type as tympanogram indicates. Option A. Normal compliance. Option B. Negative middle ear pressure. Option C. High compliance. Option D. Low compliance. The correct answer is option D. Low compliance. Let's go through the options. Normal compliance. Normal compliance is type A. Negative middle ear pressure. Negative pressure is type C. High compliance. High compliance is type AD. And the correct answer is low compliance. Type as shows low compliance, as in otosclerosis. So, the right answer is option D. Low compliance. Question 61. A type AD tympanogram indicates. Option A. Fluid in the middle ear. Option B. Retracted or hypermobile drum. Option C. Normal compliance. Option D. Perforation. The correct answer is option B. Retracted or hypermobile drum. Let's go through the options. Fluid in the middle ear. Fluid gives a type B. Normal compliance. Normal is type A. Perforation. A perforation gives a large volume type B. And the correct answer is retracted or hypermobile drum. Type AD shows a hypermobile or flaccid drum. So, The right answer is option B. Retracted or hypermobile drum. Question 62. The headache of which sinusitis characteristically subsides by evening? Option A. Maxillary. Option B. Sphenoidal. Option C. ethmoidal. Option D. Frontal. The correct answer is option D. Frontal. Let's go through the options. Maxillary. Maxillary pain is felt in the cheek. Sphenoidal. Sphenoidal pain is deep. Ethmoidal. Ethmoidal pain is between the eyes. And the correct answer is frontal. Frontal sinusitis gives a headache that rises through the day and eases by evening. So, the right answer is option D. Frontal. Question 63. Which diuretic characteristically causes deafness? Option A. Spironolactone. Option B. Furosemide. Option C. Hydrochlorothiazide. Option D. Acetazolamide. The correct answer is option B. Furosemide. Let's go through the options. Spironolactone. Spironolactone causes gynecomastia. Hydrochlorothiazide. Thiazides are not ototoxic. Acetazolamide. Acetazolamide is not ototoxic. And the correct answer is furosemide. Loop diuretics like furosemide are ototoxic. So, the right answer is option B. Furosemide. Question 64. Cyclophosphamide most characteristically causes. Option A. Renal stones. Option B. Hepatic necrosis. Option C. Pulmonary edema. Option D. Myelosuppression. The correct answer is option D. Myelosuppression. Let's go through the options. Renal stones. Renal stones are not typical. Hepatic necrosis. Hepatic necrosis is not typical. Pulmonary edema. Pulmonary edema is not typical. And the correct answer is myelosuppression. Cyclophosphamide characteristically causes myelosuppression. So, the right answer is option D. Myelosuppression. Question 65. In a patient with GERD not responding to a proton pump inhibitor with positive Campylobacter, treatment is. Option A. Double dose PPI. Option B. Triple regime. Option C. Antacids. Option D. Surgery. The correct answer is option B. Triple regime. Let's go through the options. Double dose PPI. A double dose proton pump inhibitor does not eradicate the organism. Antacids. Antacids only relieve symptoms. Surgery. Surgery is not first line. And the correct answer is triple regime. A positive Campylobacter, meaning H. pylori, needs a triple regime. So, the right answer is option B. Triple regime. Question 66. The commonest cause of hypercortisolism overall is. Option A. Exogenous steroid therapy. Option B. Pituitary adenoma. Option C. Adrenal adenoma. Option D. Ectopic ACTH. The correct answer is option A. Exogenous steroid therapy. Let's go through the options. Pituitary adenoma. A pituitary adenoma is the commonest endogenous cause. Adrenal adenoma. An adrenal adenoma is less common. Ectopic ACTH. Ectopic act is uncommon. And the correct answer is exogenous steroid therapy. Exogenous steroid therapy is the commonest cause of hypercortisolism overall. So, the right answer is option A. Exogenous steroid therapy. Question 67. Glycosylated hemoglobin is used to assess. Option A. Long-term glycemic control. Option B. Immediate blood glucose. Option C. Insulin resistance. Option D. Renal function. The correct answer is option A. Long-term glycemic control. Let's go through the options. Immediate blood glucose. It is not an immediate glucose. Insulin resistance. It does not measure insulin resistance. Renal function. It does not measure renal function. And the correct answer is long-term glycemic control. Glycosylated hemoglobin reflects long-term glycemic control over months. So, the right answer is option A. Long-term glycemic control. Question 68. Breastfeeding is contraindicated when the infant has option A. Phenylketonuria. Option B. Cleft lip. Option C. Mild jaundice. Option D. Colic. The correct answer is option A. Phenylketonuria. Let's go through the options. Cleft lip. A cleft lip allows modified feeding. Mild jaundice. Mild jaundice is not a contraindication. Colic. Colic is not a contraindication. And the correct answer is phenylketonuria. In phenylketonuria, breast milk phenylalanine is harmful, so a special formula is used. So, the right answer is option A. Phenylketonuria. Question 69. In botryoid sarcoma, which statement is true? Option A. It occurs only in adults. Option B. Radiotherapy is contraindicated. Option C. Surgery is never used. Option D. Chemotherapy is not included in treatment. The correct answer is option D. Chemotherapy is not included in treatment. Let's go through the options. It occurs only in adults. It occurs in children, not only adults. Radiotherapy is contraindicated. Radiotherapy can be used. Surgery is never used. Surgery is part of treatment. And the correct answer is chemotherapy is not included in treatment. The key marks that chemotherapy is not included. So, the right answer is option D. Chemotherapy is not included in treatment. Question 70. Aminoglycosides characteristically cause. Option A. Pulmonary fibrosis. Option B. Hepatotoxicity. Option C. Cardiotoxicity. Option D. Ototoxicity and nephrotoxicity. The correct answer is option D. Ototoxicity and nephrotoxicity. Let's go through the options. Pulmonary fibrosis. Pulmonary fibrosis is not typical. Hepatotoxicity. Hepatotoxicity is not typical. Cardiotoxicity. Cardiotoxicity is not typical. And the correct answer is ototoxicity and nephrotoxicity. Aminoglycosides cause ototoxicity and nephrotoxicity. So, the right answer is option D. Ototoxicity and nephrotoxicity. Question 71. A 16-year-old with anterior knee pain on climbing stairs is treated with. Option A. Immobilization. Option B. Opioids. Option C. Steroid injection. Option D. NSAIDs. The correct answer is option D, NSAIDs. Let's go through the options. Immobilization. Immobilization is not needed. Opioids. Opioids are inappropriate. Steroid injection. A steroid injection is not first line. And the correct answer is NSAIDs. NSAIDs relieve the anterior knee patellofemoral pain. So, the right answer is option D. NSAIDs. Question 72. Atropine of the eyelid results from underactivity or laxity of the option A, inferior oblique. Option B, levator palpebrae. Option C, superior rectus. Option D, orbicularis oculi. The correct answer is option D, orbicularis oculi. Let's go through the options. Inferior oblique. The inferior oblique moves the eye. Levator palpebrae. The levator raises the lid. Superior rectus. The superior rectus elevates the eye. And the correct answer is orbicularis oculi. Laxity of the orbicularis oculi lets the lid turn outward, atropine. So, the right answer is option D. Orbicularis oculi. Question 73. The vitreous is bounded anteriorly by the option A, cornea. Option B, ciliary body processes and lens. Option C, retina. Option D, optic disc. The correct answer is option B, ciliary body processes and lens. Let's go through the options. Cornea. The cornea is at the front of the eye. Retina. The retina lies behind the vitreous. Optic disc. The optic disc is posterior. And the correct answer is ciliary body processes and lens. The vitreous is bounded in front by the ciliary body and lens. So, the right answer is option B. Ciliary body processes and lens. Question 74. Intraocular calcification in a child suggests option A, retinoblastoma. Option B, congenital cataract. Option C, Coats disease. Option D, toxocariasis. The correct answer is option A, retinoblastoma. Let's go through the options. Congenital cataract. A congenital cataract is a lens opacity. Coats disease. Coats disease shows exudates. Toxocariasis. Toxocariasis is inflammatory. And the correct answer is retinoblastoma. Calcification in a child's eye suggests retinoblastoma. So, the right answer is option A. Retinoblastoma. Question 75. Papulovascular lesions on the forehead and nose tip with periorbital pain indicate option A, contact dermatitis. Option B, impetigo. Option C, cellulitis. Option D, herpes zoster ophthalmicus. The correct answer is option D, herpes zoster ophthalmicus. Let's go through the options. Contact dermatitis. Contact dermatitis is not vesicular in this pattern. Impetigo. Impetigo is crusted. Cellulitis. Cellulitis is diffuse. And the correct answer is herpes zoster ophthalmicus. Vesicles on the nose tip, the Hutchinson sign, with pain are herpes zoster ophthalmicus. So, the right answer is option D. Herpes zoster ophthalmicus. Question 76. In accommodation for near vision, all of the following decrease except option A, pupil size. Option B, focal length. Option C, lens curvature. Option D, lens diameter. The correct answer is option C, lens curvature. Let's go through the options. Pupil size. Pupil size decreases. Focal length. Focal length decreases. Lens diameter. Lens diameter decreases. And the correct answer is lens curvature. Lens curvature increases, so it is the exception. So, the right answer is option C. Lens curvature. Question 77. After cataract is treated with which laser? Option A, diode laser. Option B, argon laser. Option C, excimer laser. Option D, Nd:YAG laser. The correct answer is option D, Nd:YAG laser. Let's go through the options. Diode laser. A diode laser is not used. Argon laser. The argon laser treats the retina. Excimer laser. The excimer laser is for LASIK. And the correct answer is Nd:YAG laser. The Nd:YAG laser opens the posterior capsule in after cataract. So, the right answer is option D. Nd:YAG laser. Question 78. A stye, hordeolum externum, is a bacterial infection of. Option A, the cornea. Option B, the lacrimal sac. Option C, the conjunctiva. Option D, an oil-secreting gland of the eyelid. The correct answer is option D, an oil-secreting gland of the eyelid. Let's go through the options. The cornea. The cornea is not infected. The lacrimal sac. The lacrimal sac gives dacryocystitis. The conjunctiva. The conjunctiva gives conjunctivitis. And the correct answer is an oil-secreting gland of the eyelid. A stye is a bacterial infection of an oil gland of the eyelid. So, the right answer is option D, an oil-secreting gland of the eyelid. Question 79. In myopia, the size of the eyeball is. Option A, smaller than normal. Option B, bigger than normal. Option C, normal. Option D, irregular. The correct answer is option B, bigger than normal. Let's go through the options. Smaller than normal. A smaller eye gives hypermetropia. Normal. A normal length is emmetropia. Irregular. An irregular shape is astigmatism. And the correct answer is bigger than normal. The myopic eyeball is longer than normal. So, the right answer is option B, bigger than normal. Question 80. Broder's grading of malignant tumors is based on. Option A, degree of differentiation of the component cells. Option B, tumor size. Option C, lymph node spread. Option D, mitotic rate only. The correct answer is option A, degree of differentiation of the component cells. Let's go through the options. Tumor size. It is not based on tumor size. Lymph node spread. It is not based on nodal spread. Mitotic rate only. It is not the mitotic rate alone. And the correct answer is degree of differentiation of the component cells. Broder's grading is based on the degree of differentiation of the cells. So, the right answer is option A, degree of differentiation of the component cells. Question 81. Choledochal cyst may be complicated by Option A. Renal failure. Option B. Splenic rupture. Option C. Duodenal perforation. Option D. Gastric outlet obstruction. The correct answer is option C. Duodenal perforation. Let's go through the options. Renal failure. Renal failure is unrelated. Splenic rupture. Splenic rupture is unrelated. Gastric outlet obstruction. Gastric outlet obstruction is unrelated. And the correct answer is duodenal perforation. A choledochal cyst may rupture or perforate. So, the right answer is option C. Duodenal perforation. Question 82. Acanthosis nigricans in an adult should prompt investigation for Option A. Hypothyroidism only. Option B. Tuberculosis. Option C. Visceral carcinoma. Option D. Anemia. The correct answer is option C. Visceral carcinoma. Let's go through the options. Hypothyroidism only. Hypothyroidism alone is not the concern. Tuberculosis. Tuberculosis is unrelated. Anemia. Anemia is unrelated. And the correct answer is visceral carcinoma. In an adult, it may signal an internal, often gastric, carcinoma. So, the right answer is option C. Visceral carcinoma. Question 83. In cellulitis, the associated finding is Option A. Lymphangitis. Option B. Lymphedema. Option C. Necrotizing fasciitis. Option D. Abscess formation always. The correct answer is option A. Lymphangitis. Let's go through the options. Lymphedema. Lymphedema is chronic. Necrotizing fasciitis. Necrotizing fasciitis is a severe separate entity. Abscess formation always. An abscess does not always form. And the correct answer is lymphangitis. Cellulitis is often accompanied by lymphangitis, red streaks along the lymphatics. So, the right answer is option A. Lymphangitis. Question 84. The lymph nodes draining a syphilitic chancre are characteristically Option A. Firm, discrete and painless. Option B. Soft and tender. Option C. Fluctuant. Option D. Matted. The correct answer is option A. Firm, discrete and painless. Let's go through the options. Soft and tender. Soft tender nodes suggest pyogenic infection. Fluctuant. Fluctuant nodes mean pus. Matted. Matted nodes suggest tuberculosis. And the correct answer is firm, discrete and painless. The nodes are firm, discrete, rubbery and painless. So, the right answer is option A. Firm, discrete and painless. Question 85. Spherocytes in a blood film are most characteristically seen in Option A. Iron deficiency. Option B. Autoimmune hemolytic anemia. Option C. Thalassemia. Option D. Sideroblastic anemia. The correct answer is option B. Autoimmune hemolytic anemia. Let's go through the options. Iron deficiency. Iron deficiency gives microcytosis. Thalassemia. Thalassemia gives target cells. Sideroblastic anemia. Sideroblastic anemia gives ring sideroblasts. And the correct answer is autoimmune hemolytic anemia. Spherocytes are seen in autoimmune hemolytic anemia and hereditary spherocytosis. So, the right answer is option B. Autoimmune hemolytic anemia. Question 86. Maternal mortality is lowest in which maternal age group? Option A. Under 15 years. Option B. 15 to 20 years. Option C. 20 to 30 years. Option D. Over 35 years. The correct answer is option C. 20 to 30 years. Let's go through the options. Under 15 years. Under 15 carries high risk. 15 to 20 years. 15 to 20 is higher risk. Over 35 years. Over 35 is higher risk. And the correct answer is 20 to 30 years. Maternal mortality is lowest at 20 to 30 years. So, the right answer is option C. 20 to 30 years. Question 87. Repeated exposure to loud noise produces. Option A. Temporary deafness only. Option B. Conductive deafness. Option C. Permanent deafness. Option D. Tinnitus only. The correct answer is option C. Permanent deafness. Let's go through the options. Temporary deafness only. It causes more than a temporary loss. Conductive deafness. Noise causes sensorineural, not conductive, loss. Tinnitus only. It is not tinnitus only. And the correct answer is permanent deafness. Repeated loud noise causes permanent sensorineural deafness. So, the right answer is option C. Permanent deafness. Question 88. The recognized indication for tonsillectomy is Option A. 7 or more episodes in 1 year. Option B. 2 episodes in 1 year. Option C. Any single episode of quinsy. Option D. Snoring alone. The correct answer is option A. 7 or more episodes in 1 year. Let's go through the options. 2 episodes in 1 year. 2 episodes is not enough. Any single episode of quinsy. A single quinsy is not an automatic indication. Snoring alone. Snoring alone is not an indication. And the correct answer is 7 or more episodes in 1 year. 7 or more episodes in a year is a recognized indication. So, the right answer is option A. 7 or more episodes in 1 year. Question 89. Cryptosporidiosis in a patient with advanced HIV is investigated by Option A. Colonoscopy. Option B. Blood culture. Option C. Duodenal aspirate only. Option D. Stool examination. The correct answer is option D. Stool examination. Let's go through the options. Colonoscopy. Colonoscopy is not first line. Blood culture. Blood culture does not detect it. Duodenal aspirate only. A duodenal aspirate is not the first test. And the correct answer is stool examination. Cryptosporidiosis is diagnosed by stool examination for oocysts. So, the right answer is option D. Stool examination. Question 90. The practice of antisepsis is directed against Option A. Airborne spread only. Option B. Infection of wounds caused by burns or operation. Option C. Vector-borne disease. Option D. Food contamination. The correct answer is option B. Infection of wounds caused by burns or operation. Let's go through the options. Airborne spread only. It is not aimed at airborne spread. Vector-borne disease. It is not for vector-borne disease. Food contamination. It is not for food contamination. And the correct answer is infection of wounds caused by burns or operation. Antisepsis prevents wound infection from burns or operations. So, the right answer is option B. Infection of wounds caused by burns or operation. Question 91. The stapedius reflex is tested by option A. Impedance audiometry. Option B. Pure tone audiometry. Option C. Caloric testing. Option D. Rinner test. The correct answer is option A. Impedance audiometry. Let's go through the options. Pure tone audiometry. Pure tone audiometry tests thresholds. Caloric testing. Caloric testing checks balance. Rinner test. The Rinner test compares conduction. And the correct answer is impedance audiometry. The stapedius reflex is tested by impedance audiometry, tympanometry. So, the right answer is option A. Impedance audiometry. Question 92. IgM primarily functions by option A. Crossing the placenta. Option B. Mucosal protection. Option C. Complement activation to produce cell lysis. Option D. Mediating allergy. The correct answer is option C. Complement activation to produce cell lysis. Let's go through the options. Crossing the placenta. IgG crosses the placenta. Mucosal protection. IgA gives mucosal protection. Mediating allergy. IgA mediates allergy. And the correct answer is complement activation to produce cell lysis. IgM is a strong complement activator that causes cell lysis. So, the right answer is option C. Complement activation to produce cell lysis. Question 93. In HIV infection, the cells principally affected are option A. CD4 T lymphocytes. Option B. CD8 T lymphocytes. Option C. B lymphocytes. Option D. Neutrophils. The correct answer is option A. CD4 T lymphocytes. Let's go through the options. CD8 T lymphocytes. CD8 cells are not the main target. B lymphocytes. B lymphocytes are not the main target. Neutrophils. Neutrophils are not the target. And the correct answer is CD4 T lymphocytes. HIV principally infects the CD4 T lymphocytes. So, the right answer is option A. CD4 T lymphocytes. Question 94. Agglomaglobulinemia characteristically presents. Option A. Before 6 months of age. Option B. Seldom before 5 years of age. Option C. Only in adults. Option D. At birth. The correct answer is option B. Seldom before 5 years of age. Let's go through the options. Before 6 months of age. Maternal antibody protects the young infant, so it does not present very early. Only in adults. It is not adult only. At birth. It does not present at birth. And the correct answer is seldom before 5 years of age. It seldom presents early, appearing once maternal antibody wanes. So, the right answer is option B. Seldom before 5 years of age. Question 95. The rotator cuff includes all of the following except option A. Teres, option B. Infraspinatus, option C. Teres minor, option D. Supraspinatus. The correct answer is option A. Teres major. Let's go through the options. Infraspinatus. Infraspinatus is part of it. Teres minor. Teres minor is part of it. Supraspinatus. Supraspinatus is part of it. And the correct answer is teres major. Teres major is not part of the rotator cuff, so it is the exception. So, the right answer is option A. Teres major. Question 96. In a newborn with an unstable hip, the joint should be held in option A. 90 degrees flexion and abduction, option B. Full extension, option C. Adduction and internal rotation, option D. Neutral position. The correct answer is option A. 90 degrees flexion and abduction. Let's go through the options. Full extension. Full extension worsens it. Adduction and internal rotation. Adduction and internal rotation dislocates it. Neutral position. A neutral position is not therapeutic. And the correct answer is 90 degrees flexion and abduction. The hip is held in flexion and abduction, as in a Pavlik harness. So, the right answer is option A. 90 degrees flexion and abduction. Question 97. The cricoid cartilage is best described as option A. A part of the trachea. Option B. A leaf-shaped cartilage. Option C. A paired cartilage. Option D. A ring-shaped cartilage in the lower part of the larynx. The correct answer is option D. A ring-shaped cartilage in the lower part of the larynx. Let's go through the options. A part of the trachea. It is not part of the trachea. A leaf-shaped cartilage. Leaf-shaped describes the epiglottis. A paired cartilage. It is unpaired, not paired. And the correct answer is a ring-shaped cartilage in the lower part of the larynx. The cricoid is a complete ring in the lower larynx. So, the right answer is option D. A ring-shaped cartilage in the lower part of the larynx. Question 98. Oxygenated blood reaches the fetal systemic circulation through the option A. Foramen ovale only, option B. Ductus arteriosus, option C. Ductus venosus, option D. Umbilical artery. The correct answer is option C. Ductus venosus. Let's go through the options. Foramen ovale only. The foramen ovale shunts blood but is not the umbilical route. Ductus arteriosus. The ductus arteriosus carries less oxygenated blood. Umbilical artery. The umbilical artery carries deoxygenated blood. And the correct answer is ductus venosus. Oxygenated placental blood bypasses the liver through the ductus venosus. So, the right answer is option C. Ductus venosus. Question 99. Vitamin K toxicity in the neonate causes option A. Hemolytic anemia and hyperbilirubinemia, option B. Hypocalcemia, option C. Renal failure, Option D. Hypoglycemia. The correct. Let's go through the options. Hypocalcemia. It does not cause hypocalcemia. Renal failure. It does not cause renal failure. Hypoglycemia. It does not cause hypoglycemia. And the correct answer is hemolytic anemia and hyperbilirubinemia. Excess vitamin K causes hemolysis and hyperbilirubinemia in the neonate. So, the right answer is option A. Hemolytic anemia and hyperbilirubinemia. Question 100. Achondroplasia is inherited as Option A. Autosomal recessive. Option B. Autosomal dominant. Option C. X-linked recessive. Option D. Mitochondrial. The correct answer is option B. Autosomal dominant. Let's go through the options. Autosomal recessive. It is not autosomal recessive. X-linked recessive. It is not X-linked. Mitochondrial. It is not mitochondrial. And the correct answer is autosomal dominant. Achondroplasia is autosomal dominant. So, the right answer is option B. Autosomal dominant.